Right, so welcome to everybody, there we go, joining live. And welcome to everybody watching on the replay. Shall we just take a breath? I'm going to mute you. 1 second, isn't that awful? I'm going to use the power that I have and mute you lovely people. There we go. So as always, I record separately from you. So if you're joining me live, you won't be on the recording even if you ask a question because it's separate. So for anybody who's watching on the recording, well, welcome. We're going to focus on lower body today with a little bit of full body added in for good measure. So I've had a crazy morning. No surprise there. So I just want you to take a couple of minutes just to do some breaths with me and let's calm down and transition into our session this morning. So starting, as I always like to start, is just checking in with your posture a little bit. So I don't know if I'm feeling a bit stressed, I tend to be here or up in my shoulders. So just actively dropping the shoulders down from the ears, thinking about placing the head over the shoulders. So you might think about your chin parallel with the floor, and then thinking about those shoulders over the hips. So if you tend to have that slight anterior tilt, you want to tuck slightly. If you're more like here, you might want to move in the other direction. So that's a very personal thing. So just sort of maybe rocking your pelvis a little forward and back and finding that spot where you feel you can really lengthen through the spine. And from here, we're just going to take a deep breath in through the nose and a longer exhalation out through the mouth. Just really empty, empty, empty. Just 2 more, breathing in. And then longer exhalation. Now the third breath that we do, I want you to really see if you can feel that belly expand. So sending the breath all the way to the belly. So breathing in and breathing out. And then shake it off. Well done indeed. So we're just going to warm up the body now and just, get that blood flowing. Really good, and hopefully you'll leave feeling a little bit brighter this morning. Well done. For 3, 2, 1. Now we're going to go up. Now just bending as much as you feel able to. If you don't want to bend the spine too much, you can do toe taps with this. So you're keeping that length through the spine. If you're able to bend, then you can go side to side. For 3 and 2. Well done. And 1, and roll it around the world. Just 2 this time in each direction. Very nice. Last time, straight into a little squat. So you're just going to come down and just keep it really shallow to start. Soften those knees, sit on a chair. And you can actually use a chair. So if you're kind of second guessing your technique, just grab a chair and use it as a prop. It's really useful. That's it. For 3 more. 3 and 2 and 1. Well done. Coming up, bringing your feet to face forward and then turning the feet out. So we're just doing a little hip rotation, out and in. That's it. Feet out, feet in. For 5 and 4, and really turn the feet out. And 3 and 2. Well done. And 1. Well done indeed. And then we're going to go around the world in this turned out position. Just notice if that feels a little bit weird, a little bit different. That might give you a nice stretch on the hips, really nice. And then bringing the feet to face forward, do the same thing. So just noticing how it feels really different if the feet are turned out or they're facing forward. Well done indeed. And then bringing your feet nice and wide, we're just going to go side to side. We are doing a lateral lunge today. If your knees are not happy, I'm going to give you options. But we're just softening the knees and going side to side just to warm up. For 3 and 2 and 1, and then walking your feet in, coming to the bottom of your mat. Inchworm time. So if you don't want to inchworm, you can spend your time rolling down and rolling up. Or if you have any spinal issues, you keep length and come back up. So you can practice your hinge technique. If you want to come all the way out, you can come out to a plank, half plank or hands and knees, and then find your way back to a standing position. Let's do 5. Really good. So whenever you're ready, reminder that you can use a chair to come down to, step back into that plank, step in and come up. Really good. Keep going, everybody. I'm just going to turn my heat off because it's just come on. Don't need that. Really good. Okay, so if you are walking out, you can either roll through the spine, send the hips back into that hinge, bend the knees, find your way to the floor, pressing the ground away, or you can come into that half plank or hands and knees position. And then coming back to standing, optional, bring your arms above your head, a little back bend, and then we'll go again. Take your time. We're just warming up the body. That's it, make it work for you. Arms up overhead, last time. Finding what I like to slide out personally. If I'm feeling tired, that's it, and then walk back and roll it up and shake it off. So hopefully you're feeling a little bit warmer than you did 5 seconds ago. And we're going to get started. So we're doing timed intervals today. The reason we do that, everybody has different weights at home. So if we do timed intervals, you can just work out when you've had enough rather than doing reps, because that might not work for you. Starting with a squat to press. Dumbbells on your shoulders, or if you have kettlebells, you can rack your kettlebells. So just a quick rack. If you're going to rack them, place your hand out. Place that handle between the thumb and forefinger coming off the heel of the hand. Nice, not broken wrist, nice straight wrist. Bringing it in, that's your rack position. Tickle your chin. And then you'd have the other one. Or you have 2 dumbbells, or you can have those weights long. Are we ready? So we're going to do a squat to press. And then we're going to do a single leg extension where we have our arms in the air, inner elbows by ears if you can. And we're going to come forward. So it's a little bit yogic, like a warrior 3. And then you're going to bring your legs up. Now, an option here, one arm and holding on with the other. So that's a great option. So if you're feeling wobbly today, hold on. Are we ready to go? 40 seconds in each. I know you're ready. You're excited, I can feel it. So squat to press in 3, 2, let's go. So you get started, I'm gonna rack my kettlebells. So I've got 2 of the same weight, so I'm gonna rack those. Squat down, make sure your feet are evenly turned out or facing forward to press. Now you want to use the glutes to press straight up. So you're not just kind of squatting and then pressing, you are squat to press and down and up and down and up, that's it, and down and up. You're doing really well, you've got 5 seconds left. Oh, nice job. Slowly coming down. Take a sip of water, take a breather. I'm just going to fix the camera, which is a bit weird today. There we go. So we're going to do single leg extension. So if you are feeling wobbly today, hold on. And what you're trying to do is inner elbow by ear, but obviously that mobility is not for everybody. So some people are just naturally more flexible. Do what you can. Do what you can. That's it. Let's go, everybody, one leg at a time. So if you can, you're really thinking of starting, if you can, with the arms here and spreading the toes of the standing foot and just coming forward in a straight line. Doesn't matter how far forward you go, entirely up to you. Tricky one, really tricky one. But I want you to focus on this one. This one is a really nice one if you're feeling any anxiety or any stress, because you just get out of your head because you've really got to focus on this movement and what muscles you need to switch on. Pressing the ground away, wobbling is all good. And well done, take a break. Okay, we're gonna go straight onto the other side, spreading the toes of the standing foot, arms up, let's go. So remember, stand near something that you can hold on to, even if you're doing it freestanding, so that you know you've got that if you need it. Soft bend in that front leg. Exhale, draw the belly in and up to come back up to standing. And just remember, some days we feel more balanced than others. More stable than others. Really good. And remember, option to hold on. And you don't have to use that arm. If you want to really focus on your balance, you can just do those legs. Just coming back and thinking about that nice long line. So keep going. That's it. Keep going. Just for a couple more seconds. And well done. Okay, back to your squat to press. which is quite a challenging exercise depending on your weights and how it feels for you and how you're feeling. Let's go. So rack your kettlebells, grab your dumbbells, let's go. We're gonna press. And I want you to exhale press. I want you to feel powerful or powerful if you don't speak Northern Irish. That's it, up and down, exhale press. Exhale, squeeze those glutes up. So it's almost like you're sitting in a chair, you're catching yourself and bringing yourself back up. 10 seconds. You got this. Use any guttural noises that make it work for you. And well done. Take a break. Be mindful when you're bringing those weights down. Take care of yourselves. Well done. Our heat's just come on, so I'm absolutely roasting. We're going to move on to a side lunge. Now, I haven't met anybody yet who likes a side lunge, but it's very good to do lateral movements. If your knees are not happy, I'm going to give you an option. You're going to stand either holding on or freestanding. You're going to use a weight, and we're just going to lift and lower. So you're loading that abductor at the top of the thigh. And it's really, really good, and it's very effective if side lunges aren't for you. Otherwise, you're taking that weight, you're stepping out. You can have your feet facing forward, sitting into this hip. That's it, it's a hinge. Keep length through the neck and come back up. So those are your options. We're doing one side only. And then we've got suitcase deadlift. If you've got dumbbells, your suitcase deadlift is 1, 2, and up. Hinge position, you're thinking that length from the tailbone to the crown of the head as if you're hitting a wall behind you. Suitcase is 1, 2, and up. 1, 2, and up. If you can't reach the floor, totally fine. So you can either use 2 kettlebells or 2 dumbbells. Are you ready? Let's go. Sorry, just getting my timer in 3, 2. Let's go with your side lunge. So stepping out, coming down, pressing into that foot to come back up. So from the side, stepping out, sending that hip back, keeping that length, bringing the weight down and pressing back in. So down and up, down and up. So this is your working leg. Down, press that foot into the mat to come back up. That doesn't work for you. This is a great option. And try it. This one really is quite effective, especially if your knees are not happy. You've got 10 seconds left, everybody. Looking great. Well done. Nice, Starfla. Well done, Emily. Well done, Sarah. And relax. Now, I don't know about you, but that seemed like a really long 40 seconds, didn't it? Okay, we're going to go on the other side. And remember, it's not a rounding of the spine. You're going back into that back pocket, pressing into the foot and coming back up. Let's go in 3, 2, and 1. Stepping out with that other foot, pressing in to come back up. And if it just doesn't work for you to go quite as deep, you can keep it really shallow, make it work for you. Try and keep those shoulders as even as you can. So you're not doing a twist, you are still trying to keep that body beaming forward as much as you can. 20 seconds remaining. Woo! It's like a sweat box in here. Coming down, pressing the ground away to come back up. You're looking great. We're nearly done. 5 seconds, everybody. That's it. 3, 2, and well done. So if you have 2 kettlebells, doesn't matter if they're different weights, because you can kind of mix and match. And you can always do 1 set and then switch them around. So I'm going to grab my other weight And you can do this with dumbbells. The main thing here is you're keeping the weights inside the body, you're not bringing them in front. So you're going 1, 2. Now see my spine, my tailbone is out, spine is long, and then up. If it gets into your back, do it without weight. Let's go. 1, 2, and squeeze it up. So imagine that bottom hitting a wall behind you, down and up. 1, 2, and up. And remember, for that deadlift, you're bringing the weight slightly forward onto the ball of the feet to stabilize your stance. 1, 2, and up. 1, 2, and up. 1, 2, and up. That's it. 1, 2. So it is more that position, hinged position. You don't want to go lower than parallel to the floor, and relax. Well done. Place the weights down. So differently than a squat, you're not staying upright, you're sanding the hips back, which will naturally bring you forward. You're not bending the spine, you're sanding the hips back. All right, let's go with your side lunge. Last time, using the left leg, stepping out, let's go. Weight in the right hand. Beautiful. And remember, it doesn't have to come to the floor. Just lower it down as much as you need to. I want you to feel it in that glute muscle. Nice. Remember, from the side, you're going into that back pocket, pressing away. Down. You've only got 10 seconds left. You've got this. Keep going. Nice job. And remember, option to do this one, which is really nice. Isn't it, Sarah? It's nice. Really good. And relax, well done. Oh my goodness, well done everybody. We're getting there, we're getting through them. Okay, other side in 3, 2, stepping out with the right leg. For the side lunge, I like to keep both feet facing forward, but it doesn't matter if the foot slightly turns out. What I don't want to see, if possible, is the foot turning in, because that's when that knee is a little bit more unstable. That's it. Inhale down, exhale, press the ground away. Inhale down, keep that length. Inhale down, exhale, press. Inhale down, exhale, press. 8 seconds. You got this. Inhale down, exhale, press. 3, 2, 1. Well done. Oh my goodness, right, so we've got suitcase deadlift. If you're finding the deadlift is getting into your spine, put the weights down and just practice this motion. So you're really thinking of that pull. If I have a pull, I don't have a pull, how shocking. But if you think about a kitchen pull or a curtain pull, from the tailbone to the crown of the head, and you're coming down like that. So that pull stays attached to the tailbone and the back of the head and goes in between the shoulder blades, if that makes sense. All right, we ready? 3, 2, 1, let's go. 1, 2, and squeeze it up. 1, 2, and squeeze it up. Send those hips back and squeeze it up. So you're not bending the spine, you're sending those lovely hips back and up. So you can stand next to a wall so that you notice that the hips are going back. Nice. And up. Actually, that's quite good. Really good. 1, 2, and up. 10 seconds. And up. And you don't want to drop the weights forward of the body, they stay within the body. Sliding them down the outside of those legs. Soften those knees and relax. Well done everybody. Grab a sip of water. The brilliant news now is that we have our finisher. So you've done some amazing work so far. We've got a bit of a difficult finisher, but just make it work for you. So you've got fast inchworms if you want to do the inchworms. An alternative, if you just don't want to come to the floor, is press ups against a wall or against an elevated surface. Second, so inchworms are where you come down and walk out. Second exercise is a jump squat. If you don't like jumping, you're going to squat to tiptoes, squat to tiptoes. If you want to jump, we're going to do staggered. So you're going to do jump, jump, jump. Keep those knees soft. You never have to jump in my classes, just an option. Are we ready? 2 minutes. Okay, I'm putting my timer on. It's only 2 minutes. Keep thinking that. 1 minute of inchworms, 1 minute of jump squats. Let's go, everybody. Little finisher, and then you can relax. So if you want to do your inchworms, you're welcome to go quite quickly. Really challenge yourself. If that doesn't work for you, maybe find an elevated surface for your push-ups. That's it. Stay in the roll down. You can come out to a half plank position. Just take care of yourselves and work at the intensity that suits your body today. So every day is different, as we know. Really good. You got 20 seconds left. So this one, you pace yourself. It's a long time, a minute, for these exercises. That's it. And remember, length through the spine. If you have any spinal issues, osteoporosis, osteopenia, keep that length. Walk out. Beautiful. And then come back up and hinge it up. If you're able to do roll down, you can roll down and walk out. Well done, everybody. Come into standing. Let's do our squats. You're either doing squats to tiptoes or you're doing jump squats. Let's go. And you're doing little staggered ones. I think I've got about 5 seconds of these left. These are not, so just jumping works for you. Keep your knees soft. Nice. Only 30 seconds left. How hard can it be? That's it. And you can even do like a half jump. That's quite nice, rather than the full impact. Or you can do squat to tiptoes. 20 seconds. You got this. Nearly there. Or you can do little bounces like this. Make it work for you. 10 seconds. I'm sure you're warm now. 4, 3, 2, and well done. Okay, everybody, I want you to slowly make your way down to the floor. If you don't want to come to the floor, find a chair, sit on a chair and relax. If you're on the floor, find your starfish and just be very happy that the work is done. And I want you to really let the body settle, whether you're sitting in a chair, lying on the floor, whatever you're doing, just make sure your body can relax and try not to use any muscles whatsoever. Let that breathing come back to normal. Well done indeed. And we'll start with the head. We'll just do a little twist and we'll just rotate the neck. So you're just going to rotate the head side to side, looking over one shoulder, looking over the other. And again, make it small to start. Just looking over one shoulder, looking over the other. Coming back to center, softening chin to chest, and then drawing a line with the nose towards the ceiling, and back. Well done. You're going to bend one knee, and then bend the other. Snuggle those shoulder blades into the floor. Just going to float the arms up and overhead, and do little snow angel. So you're floating those arms up and overhead, little snow angel, and you're trying to get contact, trying to let the arms make contact with the floor as much as you can. Well done. And then just finding cactus arms, where your arms are kind of in this position, goalpost arms, and just relaxing as much as you can, bringing your feet wide, so bring them wider than your mat, and then just let one knee fall in at a time. So you're just doing a wee windshield wiper, side to side. Really nice. Notice how that feels for the hips. Very good indeed. For 3 and 2 and 1. Well done indeed. Bringing your knees back to bent knees, feet flat on the floor. You're going to hold one leg anywhere that makes sense to you and just draw little circles with the foot in one direction, and then the other, little ankle circles. And then place that down and we'll do the other side. Really good. And if you're clicking like me, it's all good as long as it's not painful. Really good. Well done, everybody. And you can stay here if you want to, Otherwise, rolling onto your side, slowly coming up to a little seat. And my challenge is now for you to come to standing without using your hands or using your hands slightly less. So if you tend to hold on to come up, you can still hold on, maybe hold on with one less finger. If you don't need to hold on, maybe come up with the other leg. So the leg you don't usually come up with. Very nice. And then we're just going to shake it off for 5, 4, 3, 2, 1, and you are done for the day. Amazing people. I'm going to stop the recording.